Hi, my name is Matt Geringer. I'm going to do a brief overview of our course on teaching ethics. My module is on how to develop a curriculum for teaching ethics, and I'll go through those steps in the following few slides. So learning objectives for our module on teaching ethics was to design a medical ethics curriculum utilizing backwards design, which involves 3 steps. The first is to develop a set of learners' expected outcomes, and then identify authentic assessments that are available, and finally outline a learning plan. Backwards design has many applications. An easy way to think about this is you're designing a dream house. And your first step is to figure out what kind of house you want, a lake house, a pool, a hot tub. The second step is then identifying how you're going to know that you're going to get that house. That involves kind of drawing up a blueprint. In our parlance, this is going to be developing authentic assessments of our learners. The last step, if you're doing things right, is to figure out all the materials you need, then put those together and work your way backwards to get your house. So developing a curriculum in any subject, but particularly for medical ethics, you're going to ask what our expected outcomes are first. What do we want our learners to look like at the end of our course? And this can be drawn from a number of different areas. You might have different expected outcomes based on level of training, medical students versus fellows. There might be licensing requirements that are particular to your environment, and then there might be cultural practice patterns. But at the start of your process, you want to know what you want your learners to look like or what skills they want to have at the end of your course. Once you have an idea of your expected outcomes, you then develop authentic assessments. And this is the question you're asking is, how do you know that your learners have achieved your expected outcomes? There are a number of different ways you can develop authentic assessments. Some of them listed here. Explaining is really just having in-depth discussions of concepts, including different viewpoints. Performing is doing a task properly, and you might be asking them to adapt to unexpected circumstances. Perspective of empathy is important to identify how other people may approach the topic and giving a more well-rounded idea of the discussion. And reflecting is a learner's self-assessment of their strengths and weaknesses. And all these can be used to draw up assessments in your ethics curriculum. There are a number of different rubrics that are available online and in publications that can take you through these steps as well, and they're helpful when you're designing your program. So again, to review, authentic assessments are the second step in developing curriculum. They may involve topics like explaining, interpreting, performing, showing perspective and empathy, and reflecting on their performance. And all comes together in the 3 kind of pillars here of knowledge, skill, and ability to say that they have achieved their outcomes. The last step and what we're usually best at is kind of developing a learning plan. This is putting together the boards and the nails to build your dream house, but this is putting it together for a curriculum. Different ways that you can develop a learning plan based on your topics are didactic lectures, multidisciplinary rounds, clinic wrap-up sessions, and online modules. Such as a brief overview of our module on teaching ethics, and take-home points here are that the concept of backwards design can guide your development of a medical ethics curriculum. And those 3 topics are expected outcomes, what do you want your learners to look like, authentic assessment, how do you know that you've gotten there, and learning plan, what do you need to do to deliver that information to them. So thank you for taking the time, and hopefully you join us in our teaching ethics module.